Those Those of you who are able to join us today, thank you for the continuation of our Hispanic Heritage Month series. And it provides us an opportunity to see what our faculty are doing, but really how we champion and how we support our communities, and also highlights, what it means to be in academic medicine as well. So I'm happy to welcome Dr. Padilla, and she already has her titles there, but as you can see, an associate professor, Department of Pediatrics, and more importantly and vitally critical to the outreach to the community, serves as the executive medical director, Division of Adolescent and Young Adult Medicine. And I think on that note, I will share, because I know you'll have a perspective and a lens that'll be important for those of you who are joining us today.
So with that, I'll start. First of all, I just want to thank you all for coming and participating in this event. I know your time is valuable, so thank you for sharing that time with me now. Today, what I'd like to do is give you a quick glimpse into my brain, kind of how I think about how I care for our communities of color as a Latina. I want to share my experience with you. I'm going to focus a little bit more on the Latinx population in recognition of the Hispanic Heritage Month. So we'll start with just the fact that, we're healthcare workers and physicians, and we really need to represent the communities that we serve. Our patients' lives do really depend on it. I'm sure many of you are already aware of the dangerous ratio that exists. In the US, racial and ethnic minorities have higher rates of chronic disease, obesity, premature death, and the list goes on and on, really. They have among the worst health outcomes. A number of factors really contribute to these health disparities among, again, communities of color. But one problem has been the lack of diversity among physicians. So I'd like to share a little bit of information with that. Looking at some data, and again, I looked at 2013, so that's significantly some time ago, but it hasn't really changed very much. The active US doctors in 2013 was 48.9 were white. So I'm just going to round up. So it was like 49% were white, about 12% were Asian, about 4% were Hispanic or Latinx, and 4% were African American, and 0.4% were American Indian or Alaskan Native. So we see that there's this ratio. Again, the workforce of physicians, being physicians of color, are a lot lower than the individuals being impacted by poor health outcomes, which are minority communities of color. So why does diversity in medicine matter? And I want to share this platform with you because it's something that's always in the forefront of my mind as I practice medicine each day, as I encounter individuals from our communities, which are predominantly African American and Hispanic. And it does impact how I care for my patients each day. If we look at some of the studies, there's so many studies that kind of show this and really talk about the physician workforce and having this decrease or insufficient amount of minor physicians of color who can care for our communities of color. It's a mismatch. It's the ratio, it can be detrimental. But we see that having the data shows, and the studies have proven and shared some significant points of view, and they really hit home for me. And there are two significant things that I want to just share with you. The first is that we see that from these studies that preventive care for our communities of color is greatly impacted. And that to me is very significant, because if we don't address the preventive care services for individuals, this can lead to those health disparities. Because unfortunately, the morbidity or mortalities that we're seeing in these communities of color really are preventable many of the times. But if we don't get individuals to come in to see their physicians and get those preventative services, then we truly do impact the health outcomes of these populations. And a lot of the studies that I was looking at and kind of just sharing with you the summary point is the fact that what drives that component, right? What drives that component of individuals seeking preventative services really involve communication and trust. In fact, some of the studies that we're looking at really looked at and revealed that individuals who were concordant with their primary care physicians had more effective care and then had better health outcomes. The good news about this is that, and these are studies that have been done long ago, that physicians that are more concordant, again, African-American, maybe Latinx physicians, do tend to go into these more underserved communities to care for minority patients. So the ability is there, the pipeline is set, but we have to then just fill that pipeline a little bit better. So why does diversity in medicine matter? Again, we talk about prevention as the unsung hero. If we can provide more prevention and more preventative services to our communities, we can improve health outcomes, right? And we see that communities of color are less likely to seek routine and preventive care. And therefore, when they come in, they tend to present in poorer health outcomes, more advanced stages, and with conditions that are truly preventable. So we see that the amount of premature mortality that you can save or spare is quite remarkable if we focus on preventive intervention. And we know that we can improve preventive intervention by using this, again, this concept where if you increase the workforce diversity, we can have more of a match concordance and perhaps improved health outcomes. It's not to say that it's the only way. There's so many things that impact health outcomes, again, in communities of color. And this is just one area that I wanted to share with you of interest, because I know myself that this is something that I can do, something that I can impact, something that I can intervene with in regards to caring for communities of color. So can increasing Latinx representation help address some of the obstacles and disparities that Latinx patients experience? Well, the publications and the evidence is there. It's an absolute yes. We know that. So we see the two components that I had mentioned before. Again, the concept of trust, right? And the concept of rapport. If there's opportunities to provide the patient with an opportunity to express themselves, to share what truly is ailing them, if there's opportunities for the physician to slow it down a moment and then make sure that they're providing the information that is required, for example, the information of symptoms and what truly their healthcare assessment and plan means and what they have to do, and they truly understand it, and we make sure to pause a moment, right? And this is part of that health literacy component, because when we talk about the Latinx population, one of those barriers, right, is language. So if we can just slow it down a moment, listen, be able to explain ourselves, to develop that trust, and then develop that rapport that the individual then pauses a moment and is listening to you, then we will be able to impact the health outcomes of these patients. If you look at the last paragraph, right, the last point there, again, many Latino patients, they don't understand what their diagnosis is or what their plan of care is, even with translation services. It's still very difficult to make sure that that happens. But we know and we understand that those things are important. So if they are more likely, if we are capable of relaying that information, that we know that that they're more likely to be successful and that they can participate in their own care. So they're more engaged, and engagement is just as important as the rapport and trust in providing those improved health outcomes. And if they feel that they're relating to the person that they're entrusting their care to, they're even more likely to participate. I'm sure many of you, if you are engaged in patient care, have experienced that, right? I know that patients often come to me as they transition from a previous provider or for the first time they're accessing care. And they share the fact that they feel sometimes rushed, right? They're feeling rushed. They're asking questions and about their care or what should have been their last steps. And when I take a look in Epic and I look at their record with regards to previous appointments, you may see a high no-show rate, missed appointments, things like that. So when you engage the patient about that, you may hear some of these things. So I try to be more sensitive about it. I don't make judgments about it. I just listen to them. And again, if they can have the opportunity to fully explain their symptoms and their issues and develop that trust and rapport, we know that these individuals will engage in their care and will have improved health outcomes. Again, this is my perspective. It's based on some of the literature that's there, but this is how I try to practice on a day-to-day caring for our patients. Again, increased representation of Spanish-speaking providers and providers that come from similar backgrounds as the patient can help the patients feel safe and understood and cared for. So I know that this data, again, applies to me. And I share some experiences with the populations that I care for. I was raised in an urban area, raised by my grandmother, Spanish speaking only, even though we didn't really speak Spanish very much in the home. Outside of my grandmother, I had the opportunity to really improve my comprehension and understand it very well. So I share that with my patients, and patients truly appreciate an individual, even if you don't share those levels of experience or the ethnic background, those type of things. If you can even just learn another language, a second language, right? Whether it's French Creole, I know that we're getting a lot of French Creole patients, Spanish speaking patients, learn how to use the interpreter appropriately. So that you don't lose the rapport building opportunity with your patient and building that trust. Again, these are all things that I kind of keep in mind when I'm caring for my patients. And I think, and I believe they really do improve health outcomes. Again, admissions to hospitals are very few with my patients. They know that if they reach out to me, I truly engage with them and listen to them. So it's very likely that if I make a recommendation for a plan, that they do fully follow through with it, and they tend to do very well. Again, I focus on adolescent and young adults. So most of these individuals, very few don't speak the language, but again, in pediatrics, you're dealing with the triadic interview. So you're dealing with a lot of parents as well, and they themselves may not speak the language. So then that's even an additional hurdle to navigate when you're trying to provide good care to a young adult or an adolescent or a pediatric patient. So again, I understand this and really just rings so true. And I incorporate this into my care, the way I provide care every day. Again, if we represent our community, I think we have a better chance with preventive medicine and active engagement and the ability to provide better health outcomes and overcome some of these preventable health disparities that we encounter. So serving the Latinx community. So I dive a little bit more into it, right? It's been really fortunate, right? I've been fortunate, right? So, I mean, I think my whole experience, with my schooling, I've had the opportunity to go to very inclusive schools that really advocated for diversity in their programs. So diversity has always been in the forefront. Public health has always been really important to me as well. As far back as a freshman in high school, a freshman in college, where I had the opportunity to do health disparities research over at Robert Wood through some pipeline programs, and then have always been engaged in that manner. And then participating at the medical school level in pipeline programs with the younger ones, right? Always give back. If you get a lot, you need to give back. So always promoting those components. But even with that, just knowing that diversity and advocating for diversity was going to be part of my life, and it was going to be something that was going to be integrated in my day-to-day care of patients. It's part of my professional fabric. It's part of my personal fabric. It's just at the core of who I am. I wanted to work with the Latino or Latina population because I feel it's really important to provide that patient population access to physicians that speak their language and then can work with them seamlessly, right? So I buy into it. I know that if I can relate to them on multiple levels, they're more likely to connect, and they're more likely to follow through with their care, and they are going to benefit themselves and their families as well. So I know that if I represent our community as a Latina physician, we have better chances with preventive medicine and active engagement, and again, improved health outcomes, right? But more importantly, and this is a role that's, I guess, developing significantly over time, and it's the concept of being an advocate, right? There's a lot of times in my career that I've been the only Latina in the room, of multiple individuals talking about the healthcare needs of the Latinx population, and being the only voice there to be able to say anything. And it's taken a lot of courage and boldness, because to be the only one and then be able to speak up, I know some of you may laugh at that, but it's taken me some time to get to that point, to be able to overcome the discomfort and be a voice. So I often provide a voice to that population by advancing an agenda, advocating behind closed doors. And what makes me feel good is the fact that I have a lot of patients that come in and they're really elated and they're so excited when they recognize, I'm not only speaking Spanish, but I'm a Latina too. Even if we're coming from a different country, my background, I was born in the Bronx in New York, so I'm American, as my grandmother would always make me express that. But at first, my background, I'm Puerto Rican, so I value those cultural gifts that I've received. My arroz y gandules and my pasteles, and the food is the best. So I share those things with them, and when we connect on that level, it's an experience that is unmatched. You can feel it. It's a feeling that that you're on this journey together, and that it's almost instant family. So that's been my experience, and I really wanted to share that concept with you. Again, and I know that, as I develop programs and identify gaps, because my eyes are nice and wide open, right? And I'm always seeking opportunities to identify gaps in care. What's causing this issue? Why am I always seeing individuals with this issue? This is preventable. What can I do? So I always use that knowledge and more knowledge that I acquire from patients, because taking the time to just listen a little bit, allowing them to express themselves thoroughly, then allow me to develop and invest in programs that help the community thrive. It's not enough, right? We can't remove these individuals and their problems. The social determinants of health are strong. They are strong. So a lot of times you can't remove them from the patient, but you can help them navigate and deal with some of the problems. And I do see myself in that role with this population. And part of that is taking the time to hear them out, right? Why did they miss so many appointments? They've only gone to one. The fear of deportation, the fact that they felt rushed and that the doctor doesn't really care. The fact that they don't speak any English and they've been here for a period of time. I mean, again, so if you can express those things, that doesn't matter. I'm here for you. We're going to work through this together. Let's figure it out. If I don't know the answer, I'll find it for you. You know, list the 3 things that you want me to help you with, and I'll help you with. You know, again, I don't promote this and I don't say for others to do it, but I give them the opportunity to access me through my cell phone, right? And texting me. They text me in Spanish. They have forced me to really reevaluate and take a look at language. And, you know, I did minor in Spanish culture and literature. So it took me back to, you know, the grammatical things of Spanish. So it's been interesting, and I've definitely benefited from them as well. They've taught me a lot and they've been patient with me. So these are just, I kind of interviewed myself as I was trying to come up with this presentation. So I said, you know, again, do you see the representation improving, right? So you take a look and say, do we get reinforcements? What's that look like? You know, if we know this is a helpful way to address some of the health disparities by improving workforce diversity, do I see it changing? And I'm so excited because I feel that change is coming. I see a lot of things being done that to promote this, you know, filling that pipeline, that workforce diversity, to increase that the care to underserved populations and communities of color. And I'm excited to be part of that change. You know, I look forward though to a bright future where we can provide good care, right, and good health care to everyone involved, not just the Latinx populations, right, but the African American populations that we serve, and all populations, right? Because when we talk about culture, we talk about so many different variations, right? Inclusivity, those that define as LGBTQ, so many different variations with culture. But if we can be better prepared as healthcare professionals to develop ourselves and to recognize that the core of providing good care is the development of trust and the development of rapport, and that facilitates engagement in these populations, and then they seek preventive services, we can truly impact, I feel, the health outcomes of all of the populations that we serve. I also think that we need more efforts to recruit Latinx physicians. We need to really address the lack of diversity in the medical field, period. You know, it's going to be a multifaceted approach because it's a multifaceted problem. But it starts at high school level, really, through college, and encouraging recruitment and retention of underrepresented minorities. And it's at the medical and residency level. And this is something that I've always participated in. When I was a medical student, I participated in developing some of the curriculum for SMART program. During my college years, I participated in pipeline programs and served as a recruiter to other schools and shared that component. You know, I went to Drew University and it wasn't very diverse, but they truly did support the concept of increasing diversity. It was a fantastic 4 years while I was there that this was part of their agenda. And I was able to participate even at that level. And it's made an impact because without all those components, I would not be here today. And with that, I lead into the fact that, you know, the Rutgers Hispanic Center of Excellence, and I'm very privileged to be part of that team. And because again, it's with the Hispanic Center of Excellence, that this was their mission, right? They do it at so many levels. They go to the high schools, they go to the colleges, they go into the medical school level. They provide support to faculty to promote this diversity. You know, and I'm just proud to say that I'm definitely one of the success stories, you know, but with one success story, there's multiple that have not been as successful. So, you know, my goal going forward is to provide some of those individuals reaching back and seeing ways that we can maybe facilitate the retention of individuals that really desire that. So if I had to ask myself this question, right, what do you have, do you have any advice for aspiring Latino or Latinx doctors, right? So these are to my medical students, right, to my residents, individuals that are seeking or trying to still lay the pathway, right, to care for patients. I encourage you to look at those urban areas and those populations that truly need your support and help, and recognize that you can make an impact, right? So I would say to you that look at people that look like me, that look like, talk to some of my colleagues, right? Anna Natalie Pereira, Iris Herrera, Luis, so many individuals I'm so proud to call colleagues, right? That we made it through. So we have to share that information, right? And we want to say to these young ones that are pursuing a career in medicine that they can do it, right? But they do need that support. They need encouragement and they need mentorship. So those of us who've made it need to reach back and really provide that mentorship and guidance to those seeking opportunities in the healthcare world. Again, sometimes these individuals, right, they think that it's only for the privilege. You know, my experience, I wasn't introduced to medical school, the concept even into my senior year. It just happened to be that I loved science and I loved teaching, and that's the route I was going. So it was a challenge basically going with my roommate to pick up the packet for the healthcare, I guess, I don't even remember what it's called, but basically to pick up a packet so that you can get permission to apply to medical school. And, you know, when I presented myself, someone there said, "You're going to go to medical school." And at that point, I didn't know I was going to medical school until they challenged me. So I took the packet with me and I filled it out. And I not only got into one medical school, I got into multiple, and I got into the best medical school, New Jersey Medical School, which launched my career to be very successful as, you know, as I progress on my professional track. It's been a fantastic journey, and I look forward to many more years. I want to spread the message, right? Don't keep it to yourself. If you figured something out, don't keep it to yourself. Share it with those behind us, climbing the rungs and advancing as well. You can do it. You can definitely do it. Tu si puedes. With that, I'll close. If anyone has any questions, you know, I have a lot of data. I didn't want this to be so data driven and another PowerPoint. I want it to be somewhat candid and open, and we can definitely talk a little bit if you wish.
I want to thank you for sharing the experiences. And I think that, you know, again, that's the lens why diversity matters, because through the experiences, what will happen is we'll champion initiatives and we'll add perspectives in shaping academia. So maybe can you comment on what may have been, you know, and you obviously gave, you know, the work that you do with patients. What do you feel the greatest impact, whether, you know, either on the academic side that you're making by staying, you know, as a faculty member?
That's a great question. And I have reflected on that, because once, you know, I was in private practice for some time, and my core is teaching. I love that. I came from a world where I was always teaching, and I knew that academia was going to be part of my professional fabric as well. And I've had that opportunity to do it at New Jersey Medical School. I think that it's really important that you stay engaged and balanced, because, you know, I'm not sure about, you know, I don't want to go into it so deep that, you know, there's a lot of data and information and resources that are discussed with regards to the minority tax. And I think, you know, one thing that I've struggled with is balancing some of the things, because again, passion is very strong. You want to involve yourself in everything and be the voice and just drive that forward, right? Especially if you're in spaces that perhaps others don't have that opportunity to be there, and then be that voice to make sure that we're represented in the right way. So, you know, that's been something that I'm navigating through. I think, you know, not having excuses, but just opportunities and always planning and you know, Dr. Johnson has always said to me when I come to him with an idea, you know, and I say to him, oh, I'm thinking about this and I'm identifying this and I'd like to initiate this. And he would say, you know, without a plan, right, it's only a dream. So come to me with a plan. So, you know, being very deliberate and always thinking through something from the beginning to the end, you know. I think that approach in academia has allowed me to be successful as I've reached, you know, an associate level position, which we know nationally. You know the data better than I do, Dr. Soto-Green, with regards to the number of Latino faculty, you know, at multiple levels, right? And then add being a female, a woman, right, impacted even further. So being in two categories, you know, I'm always navigating culture in some way, but I don't use it as reasons to fail, right, or excuses. I'm very proud of it, and I use it as reasons to succeed and to help others succeed.
And I think that's an excellent point, because in our journey, you know, for those of you and especially our students, it's very well described, the minority tax. And is, you know, that's the pole, right, where we're drawn to really continue to make the impact that, you know, we set out to do, and all too often we're tapped to be that representational individual on committees and work, and we know that our voice matters. But the question is, how do you balance it in a way that allows you to really continue to make the difference and the influence? So the tidbit I would always say is, you know when to say yes. Always seek out a mentor or someone more senior to kind of bounce the ideas. Don't ever shut the door fully. So you could always say no, not at the, you know, I'm unable to do so at this time. You know, that way it's not permanently closed should you want to revisit, because it could be a pathway that will lead you to really be more influential in the work that you're passionate about. And I always like to help individuals, you know, like yourself, you know, try to find that personal professional satisfaction, because that's the meaning, you know, that we give. And I think that that's the important really message. We are spheres of influence. And a physician, whether we want to or not, we are empowered with a lot of trust and care, and we can make a difference in everything we do. And we are charged with being advocates. You know, it's just how to do it, right? And the
And
time.
Dr. Soto-Green too, you know, and it's just to tag on to what you're saying. It's only because you're minority, right? And this is something that I'm learning about. Only because you're minority, you don't get to just, oh, well, this applies to me because I'm minority, right? So, you know, I've had concordant physicians, right, with me, even in my adulthood, in my childhood, concordant, like there was a Latina physician, and they were terrible. They're terrible. So it doesn't mean that, you know, again, you have to be Latina or Latino that you provide the best care to concordant patients, right? And the same thing, even with programs and activities, only because you share concordance with a patient or community or a group, right, doesn't make you always right. And sometimes you need to back off and see the bigger picture, because you may need to lose some battles and give in so that you can win bigger battles later down the line that benefit a larger group of individuals. And I've learned that because, you know, associate professor, whatever it is, there's always somebody higher than you. There's always somebody more powerful, right? Somebody with more influence than you. So if you don't have that, and what you're going to do is kind of push your agenda, and you're not going to be able to push it very far, then wait a little bit. Recruit other individuals for your message so that you can be more effective in it.
So I think that's a very powerful, important message that even in our mentorship, because there's always that debate, is it an advantage to have, race, ethnic concordance? Yes, it may be of added benefit, but not always, right? And we live and practice in worlds, right, that we are interdependent, we build teams, and therefore we should have the allyship and nurture that type of allyship, right? That will really impact the community, and impact each other personally, and professionally in our group, but really saying more in the professional sphere, we can impact each other, and most mentors, most sponsors, most coaches, right? Most networks are not going to necessarily be made of us. And so therefore, we have to have the right communication skills to be able to navigate and really work in teams, deliver. So I think that's a very important message. I'll say in a silo, because that's not how we practice our care, and that's not going to lead to our own, professional success. Are there any questions from those that are attending? Otherwise,
I'll say that I interviewed a student for the medical school who she never knew she wanted medicine until she went to a cohort of professional females, and they were discussing their journeys and their stories. And it was until her senior year of college that she found what other women in her field were doing, and she was able to shadow them and build those relationship connections. And before defensive opportunity with surgeons or something else, they do breakfast in the morning as a group and then discuss patients and stuff. And she saw a round table of women who were doing her profession, and that's when she saw herself for the first time as a doctor. And I think that those experiences are needed more in our community and are part of breaking the cycle for people to get into medicine.
And Humberto, that's definite, right? Because I'm telling you, I was accepted to multiple medical schools, but when I went to New Jersey Medical School and I was interviewed by Dean Foster, who is African-American, right? And he made the case because I knew I wanted service. I knew I wanted academia, and he made the case. But when he introduced me to Dr. Soto Green, that was like, where's the fax machine? Let me send, yes, a fax machine. It wasn't a scan or anything like that at that time, but a fax machine to withdraw from the other schools, right? Withdraw my application. It's very powerful. But see, if we recognize that, right? If we recognize that, what do we do with it? Do we just keep it to ourselves, or do you recognize that and then try to help others? Or do you keep it to yourself? That's the challenge.
Correct. And I'll put Jorge on the spot right there, which is the only male here. Two more males in here. Jorge and I went to a Peruvian flag raising ceremony, and I knew that he would be there. So there's a bunch of students doing the Peruvian dances. And then I told them, I go, this is Jorge, he's a medical student, he'll be a doctor. And you should have seen the eyes of these kids, like they just pop up and go, a doctor, he's one of us. And I think that's the impression and the impact that we have in the community. And I think that that's how we can make a difference.
Yeah. Jorge, you're gonna make a comment?
Oh yeah, I was just gonna say, definitely a true story, and we have the photo evidence for that. But I also did want to ask a question on the presentation, kind of going off of your last slide here. So first of all, thank you, Dr. Padilla, for giving this presentation. And I'm a second-year medical student. My name is Jorge. And going off of your last slide here, so because I'm a second year and going to transition into clinic soon, one of like, not a concern, but like something that's like kind of been in the back of my head, because I've heard like a lot of stories, whether it be from students or faculty like yourself that come back and give talks. Going off of that minority tax, if you will, sometimes in clinic, like whether it be minorities or especially minority women get questioned a lot, about their position, their expertise, their intentions or what have you. How would you go about dealing with that if that ever comes up? If you ever feel antagonized, I guess, like maybe based on your identity, whether it be from an attending or a patient.
Can you simplify the question?
If you ever feel like you're being, I guess, like questioned in a way that you think is calling into question your identity, whether it be in your case, like as a woman or a Latino in my case, or somebody kind of makes a side comment alluding to that, how would you deal with that?
Well, Jorge, I mean, I think everyone on this call can probably attest to the fact that's happened, right? I mean, as a woman, right? There's a lot of times that individuals assume that you're the nurse or med tech. And when you rotate with us, you'll see it happen right in front of your face. You see it where I'm standing there pulling a sheet from the little box that you guys pull the next patient from. And I'm looking at it and someone will come up to me. That can be a patient. It's usually a patient, sometimes a medical student. And they'll say, speak to me and ask for something as the med tech, right? And even though I have scrubs on, which may contribute to it, but on the scrubs, it says Dr. Padilla on it, right? So you get used to it, right? And you have two choices. You can be offended by it, right? And then close off, or you can take an opportunity to teach something to someone about themselves, right? Because that judgment is more about them than it is about you, right? So you pause, right? And you say, oh, I'm sorry, like I do. I stop and I'll say, oh, I'm sorry, I'm one of the attending physicians, but how can I help you? Let me see if I can get you someone that can help you. You see, but it's your choice. You can take either path. You can be offended by it or take it as an opportunity to teach something to someone. All right, but that's as a woman, because again, if you're offended, there's something in you, right, that got offended and that you permitted it. What is it? Is it the imposter syndrome? Maybe, oh, that person thinks I'm, but it's what they think. It's not the fact, right? You are a physician, so then just readjust an individual. Well, to just add to that little piece, because again, for the students that are here, and if you identify as Latino or Latina or Latinx in general, right? One thing that may happen, and I still encounter it as an attending, is the fact that you observe the biases and how it impacts the care of your patients. That you see it's a negative impact, where a sheet that is placed in a box, everybody keeps moving it because they're Spanish speaking and they don't want to see that patient, right? Or they speak loudly to them, or they make them wait a little longer because they have to discharge them at the end of the visit and they can't really explain everything, on the after visit summary. So they wait a little longer, right? They don't use the interpreter services that are available to them. If they use them and they speak to them with their backs faced to them, right? And the phone is, blaring out someone speaking. I've walked into things like that, right? And then I have to undo it as a physician so that I can recollect that rapport, because not only is the rapport important for you, right? Individually between us, me and the patient, you and the patient. The rapport is important for how that patient feels in that climate, in that environment, right? So if it's a pediatric practice and med techs are doing that, or the front desk is speaking to them a little bit more sternly, right? And not really connecting with them, they're not going to feel cared for, even if you are the one caring for them. I've had patients say to me, and this is now, right? Says, Dr. Padilla, and they're saying this to me in Spanish. I've known you since, my two kids who have been born. You've cared for me when I was a young adult, but I can't take it anymore. I feel disrespected, right? I can say, oh, well, and become defensive, right? Oh, we provide care, we care for everyone, but I don't. I listen to them, and then I go on to explain to them, ask them, right? Ask them, what made you feel disrespected? So we can address it. But that's someone who can speak out. Majority of our patients do not speak out. They take the disrespect and they just take it and accept it, and that's one thing as I practice in a setting like that, right? Which is urban and more communities of color, I intentionally go out of my way to make them feel powerful and empowered and that their voice matters. And that's probably the beginnings of my session with them. It's not, oh, is the baby feeding up? Nope. How are you doing? How was your visit? I'm sorry for the delay. Apologize, right? I'm in here with you. I'm going to stay with you until we finish our visit. If you gave me 5 complaints, right? That can drive a physician nuts, right? You have 15 patients and it's like, I have 5 things and this hurts and this hurts. And you're like, oh my God. It says, I hear that you have 5 complaints. If I can only take care of 3 of them, which are your most important ones, right? Again, make them feel heard, but they can read. My teenagers, guys, oh my gosh, they could read through, genuineness. If you're not genuine and you're just going through the motions, yes, and they will eat you alive because they would point it out, they would bring it out to you, right? So it's about really feeling it and then being able to express that in a genuine manner to your patients, all right? And that may be put your feelings aside for a moment, even if you feel disrespected in some way, and then convert it into a teaching moment so that everyone walks away from that encounter benefited.
I would say, Jorge, it is going to happen. It does happen to individuals, right? It may happen differentially, right? Depending upon, your status and etc. But what we do as part of our curriculum, and we're going to be more institution-wide, is to continue our journey in terms of achieving, equity, right? And being an anti-racist environment, is to give you the tools, right? And there are tools and you'll go through it, as you continue your education on what's the language, what are some of the things that you can use, for communication, either real time or where to refer, because sometimes it's best someone else addressing it, but also what we do want to do is to empower you on how to address that accordingly, right? The one thing we cannot do is, remember, we want to judge the behavior, not the person, right? If the person's behavior, if they've never been told that, their comments, and it gets more tricky because hospitals haven't figured it out. My affiliate partners, some of them have it in policies, some don't, is what happens when there's a bias by a patient towards a provider, right? Remember, because we're always, and how do you navigate that, right? But the one thing is that, we really want to try to help mitigate what you are referring to as microaggressions, right? So that way you can learn how to manage them. And then we have how to help those same individuals understand that, what the world has changed and that these are not acceptable, because they do affect our well-being. But, and we may have lapses at times in terms of, I think the emotional lapse as well, right? Because we are human, but what we're trying to really avoid is those moments where, anger sets in, right? Because you were just that next person and I can't take it anymore. So those are the things that, again, in your journey, through medical school, through residency, through us in our careers, I would tell you, I would love to say that I'm devoid of it. No, absolutely. The position doesn't necessarily make you immune to some of these, but I certainly have a repertoire of how to handle it and when, and it's only through continuing to refine, my voice and when to use it and how to use it. So that way the individual or individuals understand, that this should not continue, right? And I feel a responsibility, because that way it's preventing it for somebody else to be affected. So those are just, and you've heard, again, how Dr. Padilla has certainly navigated it. We would love to tell you again that it will not be true, but that is not necessarily the.
So Jorge, what do you think about what was just said?
I think, thank you both for your perspectives. I think that's what I wanted to hear, because I know I can keep a level head in all these situations, but I like the fact that you kind of gave a formula in a way, like listen and like take it as a chance to educate. I mean, as I like teaching as is, you know, but so it's a nice way like to think about it, just to be constructive about it and understand that it's going to happen. So I really appreciate both your insights, kind of like confirming a little bit, like kind of like what I thought would be the answer in a way, but hearing it from people with that experience is very valuable. So I really appreciate it.
I think what we don't want is what has been true for all, for us and especially my generation. What we don't want is silence, right? Right, so silence is already allowing the practice to continue. But like anything, we have to really know how to manage the particular situation, and so that we are very expert and resourced to help our students navigate that, quite well. And so you'll continue to refine and learn and come to us, and we will have the appropriate timing tools or empower you with the language as well, because that's the key thing, right? Practice and comfort makes perfect. And we've had students that then go back and say, no, I'm going to handle it. But typically they'll either go, come in, to speak with, Dr. Hill or the clerkship director or myself, but we do monitor for all of this, on a super level, on a quarterly basis, in addition to what students write in terms of feedback, that will help us in their clerkship report. So it's a little bit different than what you're experiencing now, but just know that there are enough safeguards in place.
And it occurs every level. So we have the ability to go to Dr. Soto Green or go to our peers. I might go to Anna, Dr. Natalia Pereira, somebody else, because something will always catch you off guard. So it's always a work in progress, so, and you do learn the tools, and you keep just, it's culmination. It's like, just keep learning and you get better at it. Okay. So don't have confidence in yourself. The fact that you're asking these questions, it's fantastic. You're already on the right track.
Absolutely. So I don't know if we don't have any more questions. I see a few more faculty joined us, including.
If anybody has any final comments or anything, they don't have to be questions. Please take the platform.
I don't know. I see Dr. Natali's name up on the screen.
Yeah, I kind of joined a little late. I was just finishing the SAVE program. Unfortunately, we're run behind with our pap smear program. Talk about taking care of people in need. So I'm glad to be able to at least log in for the final comments.
You want any parting words?
No, and in fairness to the conversation, I'm sure Dominga did a great job. Certainly reaffirming what you said about this to the students, about really how we check at the top, really keep really an eye on this relationships and this microaggressions issues.
So I think on that note, we will end. But thank you everyone for attending, and then this will be, available.